Hi, I'm Clint Maggott. I'm a psychologist working at Lentegeur Hospital in Mitchells Plain. It's a psychiatric hospital, services generally in the Cape Flats, the Khayelitsha and Mitchells Plain areas, as well as some Boland and Overberg areas. It services a community that has historically been quite disempowered. It's an area with a lot of social problems, both in terms of violence, and so it's quite a traumatized community as well as quite a poor community. And these are the patients that I see every day, and I've been there for some time now. And working in state is interesting because you get quite a lot of patients with a little bit of time and a little bit of resources. And for a long time, I think it's been something that I've always just built up frustration in me that, this is a problem, nothing can change, how are we going to do anything about this, we're just stuck in a bad situation. And you yourself as an individual, as a healthcare provider, you feel quite disempowered as well. And so, through thinking about this problem, I've become involved in a couple of areas. The one is the Spring Project Foundation, which is a project that was initiated by Dr. John Parker, and I'm one of the founding members of the foundation. And it's really aimed at using principles of social innovation and the recovery model to bring about change with this community, that we can engage with them in a very different way, that destigmatizes them and actually empowers them. And underneath this, there's a range of projects. I've also been involved as the Innovations Coordinator for the Department of Psychiatry and Mental Health at UCT, and I've engaged quite a lot with the Innovation Hub. And so through this exposure, my idea is really to start leading a peer-led services at Lentegeur. So instead of us being the only people that really provide and have input in the patient services, to have this be driven a lot more by patients, and to have them really be a part of the work that we do and their own recovery and also the interventions to them. And so the idea is that they start providing services to each other, supportive services, thereby building a more empowered community and really bringing about some kind of social activism in that community, which is quite stigmatized and quite isolated. And so that's really how we want to bring about a change. And I think this is really the way forward for the public healthcare generally, is that we're going to need to involve our end users in what we do. And I think this changes not only their disempowerment but our own as healthcare providers. I feel that I'm capable of doing this, but I also need a lot of assistance, and so therefore I'm doing the MBA to really give me the skills and expertise necessary to take this to the next level. Thank you.